On the Medical Watch now, searching for early signs of brain decline. Alzheimer's disease is hereditary, and as people experience memory lapses, they often wonder, is it aging or something worse? Brain Guide is a new tool helping people check their memory and find resources related to dementia and Alzheimer's. Dr. Philip Gorelick is a neurologist with Northwestern Medical Group and the Feinberg School of Medicine, and he joins us now with more on how this tool works and why it is so important. Doctor, thank you for being here. There are so many people impacted by Alzheimer's, 5.8 million in this country. And I think knowing that it is a familial disease, so many people would love to have an indicator of an early sign that maybe they are getting this.
Well, thank you for having me, first of all, Dina. And on behalf of Us Against Alzheimer's and the Brain Guide, I'm pleased to be here. The Brain Guide is a free, easy, accessible, simple to use tool that has a number of modules that will help the patient or the caregiver on their journey. For example, if you want to learn about signs and symptoms of Alzheimer's disease, the Brain Guide will take you through that. If you want to learn about detection, diagnosis, and treatment and prevention, the Brain Guide will take you through that. And if you need resources as a caregiver or as a patient, the Brain Guide will take you through it. The Brain Guide will begin with a hello, a very warm welcome to individuals who are using the tool. And it can be accessed either by telephone or it can be accessed through the internet. It's also in English and in Spanish. So a lot of great care has been taken to develop the Brain Guide in a way that's easily accessed and usable.
It sure is. I actually took the test, doctor, and sometimes I wonder, it's like you can't think of a word and your memory starts to decline and you wonder, is it anything serious? What I'm wondering is, it was a few basic memory words, some simple math. How is it that you take that information and interpret whether forgetfulness is just forgetfulness or it's a sign of dementia or Alzheimer's?
Well, the Brain Guide begins with a test phase, and there are up to 8 questions that can be asked. And it's a screening test. It doesn't make a diagnosis, but Brain Guide gives you a screening idea if it might be beneficial for you to go to a healthcare professional. Healthcare professionals will welcome this additional information because we're always looking for it. We know that patients are going on to the internet, they're going to websites, they're gaining information. They often bring that information into the office. So we're prepared to welcome people who have this information, and you get a score. And the score that you get from these questions that you answer is the guidance for screening whether you need to see the doctor or not.
So, doctor, there's no cure for Alzheimer's. There's really no preventative treatment. So if you find out that you might be getting it, what are you really going to do with that information? I know it's going to cause some fear.
Well, I think the important thing to remember is that we used to think that there was no way to prevent some of these neurodegenerative diseases such as Alzheimer's. But what we've learned is that these diseases are linked to cardiovascular risk factors such as hypertension, diabetes, high cholesterol, physical inactivity, obesity, poor diet, and others. And so what we're doing now is we've changed the paradigm. Early on in life, we're recommending that people follow Life's Simple 7 and get these particular risk factors under control. And as we age, and if we start developing word finding difficulty, problems with our memory, difficulty with calculation, at that point, we're attempting to intensify our approach to control these risk factors because we believe that they may reduce the risk of progression or prevent the occurrence of severe cognitive impairment. So,
right. So this could potentially impact your health overall. It's a great idea, doctor. Thank you so much for your time and all the work that you put into this.
Thank you for having me.
If you at home would like to try the test or find out more, visit mybrainguide.org. Ben and Lourdes.
Okay. Thank you. Very interesting. Thank you, Dina.